Urinary tract infection, commonly known as UTI, is one of the most frequent medical issues in women worldwide, affecting millions every year, and it occurs when bacteria invade any part of the urinary system, which includes the kidneys, ureters, bladder, and urethra, leading to discomfort, pain, frequent urination, and sometimes even severe complications. Women are significantly more prone to UTIs compared to men because of their anatomy, as the female urethra is shorter, which makes it easier for bacteria to travel quickly into the bladder, and the most common culprit is Escherichia coli, a type of bacteria usually found in the intestinal tract that can spread to the urinary system due to poor hygiene, improper wiping techniques, or sexual activity, but other risk factors such as diabetes, pregnancy, menopause, weakened immune system, dehydration, kidney stones, use of catheters, hormonal imbalances, and prolonged use of antibiotics also increase the likelihood of infection. Symptoms of UTI in women include a burning sensation during urination, frequent urge to urinate even when the bladder feels empty, cloudy or foul-smelling urine, blood in urine, lower abdominal pain, pelvic discomfort, nausea, and in severe cases high fever, chills, back pain, and vomiting if the infection spreads to the kidneys, a condition known as pyelonephritis, which can be life-threatening and lead to permanent kidney damage if left untreated. Hence, early diagnosis and treatment is extremely crucial. Doctors typically prescribe antibiotics as the primary treatment for UTIs, and along with medication, patients are advised to drink plenty of water to flush out bacteria, urinate frequently, maintain proper genital hygiene, and sometimes include cranberry juice or supplements and probiotics to support bladder health. Although these are supportive rather than curative measures, pregnant women are at special risk because untreated UTIs can cause premature labor, low birth weight, and other complications, which is why regular urine checkups are recommended during pregnancy. Preventive strategies for women include drinking at least 8 to 10 glasses of water daily to flush toxins, never holding urine for too long, urinating after sexual activity to flush bacteria out of the urethra, practicing correct hygiene like wiping front to back to avoid bacteria from the anal region reaching the urinary tract, avoiding harsh chemical soaps, vaginal sprays, and deodorants that disrupt natural pH balance, wearing breathable cotton underwear instead of tight synthetic fabrics to reduce moisture, reducing sugar intake since bacteria thrive on sugar, and strengthening immunity through proper nutrition, sleep, and exercise. UTIs are not only a physical burden but also impact women's mental health, as the constant discomfort, pain, and need to visit the bathroom repeatedly create stress, anxiety, and social withdrawal, sometimes even leading to depression. Globally, statistics reveal that around 150 million people suffer from UTIs every year, with about 50 to 60% of women experiencing at least one UTI in their lifetime, and the financial cost is staggering as billions of dollars are spent annually on antibiotics, diagnostics, and hospitalizations. Recurrent UTIs are a significant problem in women, especially those with weak immunity, poor lifestyle, or unmanaged chronic conditions, and in such cases urine culture tests are crucial to identify the specific bacteria causing the infection so the right antibiotic can be prescribed, because random self-medication or taking leftover antibiotics is extremely dangerous, as it can lead to antibiotic resistance, making future infections harder to treat. In addition to standard treatment, natural remedies may help support healing, such as turmeric and ginger with anti-inflammatory properties, garlic known for its antibacterial effects, vitamin C-rich foods that boost immunity and make urine less hospitable to bacteria, green tea, and probiotics like yogurt or fermented foods that restore good bacteria balance, though these should always be seen as complementary and not a replacement for medical care. Awareness about UTI is still low in many parts of the world, and due to social stigma or shyness, women often avoid seeking timely treatment, which worsens the condition and causes recurrent or severe infections. Education, open conversations, and breaking taboos around women's health are vital to reduce the burden of UTIs. Healthcare experts recommend women to recognize early symptoms, never ignore pain or burning during urination, and seek medical advice immediately to prevent complications, because a simple bladder infection can escalate into kidney infection or sepsis if neglected. In summary, urinary tract infection is a very common yet serious health issue in women, caused mainly by bacterial invasion into the urinary system, presenting with painful urination, frequent urges, and discomfort, treatable with antibiotics and lifestyle adjustments, but preventable with good hydration, hygiene, timely medical care, and a healthy lifestyle. And the key message is that UTIs are not something to be ashamed of but a medical condition that requires attention, treatment, and awareness to protect women's health and overall well-being.